Great. How are we going? We're a minute past. We might just wait.
Sure.
We'll wait a minute or so. I think I can see a couple of people still joining us. So I think most of you will have seen that there's a recording notice. So the meeting that we're attending will be recorded, and the recording will be made freely available after Erik's talk for people that may not have been able to attend today. So look, I think in the interest of time, we will start. It is a great pleasure to welcome Dr. Erik Aarden to the New South Wales Health Statewide Biobank this afternoon. Erik is joining us from the University of Klagenfurt in Austria, and I think he is our speaker who is joining us from the greatest distance since we've been running these talks in 2020, and that's, I think, a great thing. And so just by way of background, Erik is currently a postdoctoral fellow within the Department of Science, Technology and Society Studies at the University of Klagenfurt. And in his research to date, he has focused on the allocation of public rights and resources in the context of medical research and innovation in Asia, Europe and the United States. And he has focused on biobanking and genetic testing. So prior to joining the University of Klagenfurt, Erik has previously worked at a number of institutions, Maastricht University in the Netherlands, Aachen University in Germany, as well as the Harvard Program on Science, Technology and Society in the US, and also the University of Vienna in Austria. So Erik is going to talk to us today about the challenges of being an infrastructure, a socio-technical perspective on biobanking initiatives in Singapore and in Europe. Thank you very much, Erik.
Yeah, thank you very much for the kind introduction and for the invitation. Good morning or good afternoon or good any time of the day, wherever you are, which is always the interesting thing about these virtual meetings. I was very pleased to get this invitation to talk a bit about my research. And I'm very much looking forward to hearing your responses. Before I start, actually, I want to dedicate a few words to the memory of Professor Andrew Webster, who is has been one of the leading figures in the study of science, technology, medicine, and society. Unfortunately, Andrew died this past weekend. And although I've never, he may, so not everybody attending here may have known him, but I've never formally worked with him, but we've exchanged a lot over the years in different kind of settings where we met at conferences. And he has always been very constructive and supportive to the kind of work that I and many others have been doing. And I think, and he was also a very kind person in addition to that. And I think in some ways, much of the exchanges that I had with him have sort of also shaped the kind of work that I presented today. So I thought it was a good opportunity to just briefly remember him here. Now, for what I want to do in the next half hour or 20 minutes or 40 minutes or so, is first give you a bit of background of the research that I've been doing that I will be presenting today, then introduce briefly what I mean by this notion of a socio-technical perspective, which may be familiar to some, but maybe not all of you. And then talk about the two really case studies that I want to talk about. So one of them is the Singapore Tissue Network, asking the question, what happened to the Singapore Tissue Network? And then follow up on that story with the question whether the challenges that the Singapore Tissue Network faced, giving a bit of a spoiler, it had some problems, whether these challenges are unique, and do that on the basis of some of my insight from still ongoing work I'm doing on BBMRI, Erik, and then in the conclusion talking about biobanking in, with, and for society. So as you've just heard, I've been working in many places over the years, and actually the research I'm presenting today comes from two different research projects. One of them was a so-called EU Marie Curie fellowships, which allowed me to spend some time at the Harvard Program on Science, Technology, and Society, where I did research on sort of how different biobanking projects, including the one in Singapore, as well as in the United States, and a larger research project also in India, sort of required or sort of negotiated the requirements of working in their particular context, as well as contributing to global interests in medical research. And the second one is, like I said, a currently ongoing project that I was working on at the University of Vienna before I came to Klagenfurt about nearly a year ago. It's a collaborative project on different European research infrastructures between the University of Vienna and the Technical University in Munich in Germany. And of course, very many of these ideas have been developed in collaboration with different colleagues in these places, as well as the different participants in the research. And I would particularly also like to mention my host at the National University of Singapore, who supported me in doing the research there. So what I will be presenting will mostly be based on interviews I did with people involved with these biobanking projects, both as sort of practitioners as well as administrators, and I analyze published materials, journal publications, but also media representations, annual reports, and those kinds of things, and did a little bit of observations at conferences and other kinds of events, particularly in the BBMI Erik case. My shared interest across these cases is the question how biobanking initiatives evolve in relation to their particular social environments, and how this affects the practices, purposes, and promises that are made around these biobanking projects. So how I look at biobanks specifically, I was a bit too quick, sorry. Is from what I call a sociotechnical perspective. And on the one hand, right, so this notion of sociotechnical has the idea of the social and the technical together. And on the one hand, I think it's a very intuitive idea that technology has great social influence. One sort of very obvious example is, of course, this seminar as such, which we would not be able to do with sort of the technological support of, in this case, Microsoft Teams. And over the past year, almost 2 years now of the COVID-19 pandemic, we have, of course, seen very many of the kind of social influences that this particular technology can have, including sort of the development of new kind of social phenomena, such as Zoom fatigue, which is not something I think we've heard before. We've heard of before, sort of spring last year, I think. The thing that's perhaps a little bit less intuitive is that society also shapes how science and technology developed. On the one hand, this is a sort of broad question of how decisions are made about what is particularly being studied. There has been, for example, some work about medical and health research and the question why it is that there's more investment going to sort of innovative technologies such as stem cells or genomics rather than doing research on, for example, health disparities. And a classic example in sort of the social studies of science and technology is the bicycle and sort of how different kinds of user groups have influenced the shape of the bicycle, that it turned from these kind of odd-looking machines that we know from the 19th century with the one large and the one small wheel to these sort of more common kinds of bicycles that we have today. So a key observation of several decades of research in this area is that the social and natural, or the social and the technological, cannot neatly be separated, and that rather they mutually influence each other, and we can think about the social and the technical as hybrids of both. And if that is the case, as well as if we accept that science and technology are sort of constitutive of the modern world that we live in, it becomes important for social scientists to study how science and technology are jointly configured. And this is happening in very many domains, of course, including medical research and research infrastructures also. So what specifically does this mean for research infrastructures. One thing to know that has been noted is that actually we often don't give a lot of thought to infrastructures, and that often we only notice the infrastructure when it doesn't work. As a small example, some of the sort of intricacies of how online platforms and software work were brought to mind again as I was having some trouble to getting this presentation set up and running. But this is not always the case. Infrastructure can always be very prestigious. We can think that there's a reason why politicians all around the world like to cut ribbons when a new road or bridge or whatever is opened. And of course, infrastructure can also be contested in terms of what exactly and where exactly this is built. Now, this is true for infrastructures in a very broad sense, but it also applies in some ways to research infrastructures. One particularly interesting thing or difficult thing about research infrastructures is that they are often sort of difficult to define. There are very many different definitions that often remain relatively broad and talk about some joint characteristics. So to just give some examples, earlier this year, the RIVIS EU project published a white paper on collaboration between European and Australian research infrastructures and cites a number of different definitions. So it mentions a definition by the European Commission, which defines research infrastructures as facilities that provide resources and services for research communities to conduct research and foster innovation. Then this project itself has developed something called a communication toolkit for European research infrastructures, which defines research infrastructures as an organization the research community to use specific facilities, resources, and services in order to accelerate scientific achievements and promote sustainable research. And again, on the other side of the world, the Australian government's National Innovation and Science Agenda included a working group that defined research infrastructures as the nationally significant assets, facilities, and services to support leading-edge research and innovation accessible to publicly and privately funded users across Australia and internationally. So you can see that there's some commonalities between these definitions. One thing that's interesting, I think, is particularly the Australian definition, which quite explicitly talks about the national context and both Australian and international users. So rather than trying to develop a definition here, I'll be working with some arguments made in the social science literature that consider what an infrastructure does rather than what it is. And I think three important elements that I sort of will follow up on in my presentation is that infrastructures establish new kinds of relations. So they're always relational. They are experimental in the sense that they create sort of new kinds of social and technical phenomena that are not always foreseen by the designers of the infrastructures. And they entail promises about what an infrastructure can contribute to science and society. So focusing on these relations, new realities and properties in what I would call sociotechnical terms, I consider two cases and ask if we can get any general insight from their similarities and differences. So I'll begin with the Singapore Tissue Network, which was a centralized repository for samples and data. It was established in 2001, but funding was terminated and it closed in 2011. So there's the story of what happened. But why did this happen? And in presenting this part of the paper, I will largely draw on a paper that also, I think, played a significant role in getting the invitation to talk here, which was published in 2017 in the journal Science and Public Policy, where I analyzed this case. So the Singapore Tissue Network was established in 2001 and was supposed to be a support facility for the so-called Biomedical Sciences Initiative in Singapore. The tissue network did not recruit nor collect samples itself, but formed a centralized storage of tissue that was collected in projects that already received funding from national grant agencies in Singapore. The main reasons to establish this network were, on the one hand, to standardize the quality of storage, On the other hand, to sort of control and reduce costs, since if you have only one facility, some of the basic costs only have to be paid once, and it was to enable access for other researchers to make use of the samples in the repository. Now, the Biomedical Sciences Initiative in Singapore predominantly had important economic aims. It was supposed to contribute to economic growth in Singapore, which means that the aim to improve quality and the productivity of research was pursued through enhanced collaborations, as well as to obtain user fees from the companies requesting access to the samples. And some of the people that I interviewed in Singapore were actually somewhat dismissive of the collection strategy that didn't sort of follow an organized strategy, but sort of happened by chance. For example, this senior researcher emphasizes that the collection started with what he calls the low-hanging fruit, that two main research clusters tied to major universities, the National University Hospital and the Singapore General Hospital, already had and were willing to make available. And this idea that there is no clear strategy or purpose to the collection is widely shared, not only in relation to what was initially kind of contributed by these two clusters, but also in relation to the later contributions that were coming from individual research projects. There may have been a plan in the individual collections, but not necessarily in the overall collection. From the point of view from the main funding agency in Singapore, as well as the designers of this repository, was not so much what was exactly collected, but how to secure the quality of samples and of sample storage. So on the one hand, the Singapore Tissue Network was built as a state-of-the-art facility built on the Biopolis Research Campus, which was itself a very prestigious sort of place. And the biobank, which was in the sort of brownish building on this picture, was fully automated in terms of sample monitoring and retrieval. But the repository, the tissue network, also took great care to secure and standardize the quality of the samples that were brought to its building at Biopolis. So again, the interview quote here gives some details about how specific technical tools were used that served on the one hand to make sure that the samples would arrive in a good state, particularly in the sort of difficult subtropical climate of Singapore, but also that sort of mechanisms were developed to make it as easy as possible for researchers who were collecting samples to also then have them stored at the Singapore Tissue Network, which was sort of voluntary at the beginning and then later became obligatory for any researchers having national research grant. But this is only one side of the equation when we think about the design of the Singapore Tissue Network. The other side is how the tissue network would make samples available and above all would stimulate collaboration. So the first of these two quotes is from a senior government official who emphasizes the aim of stimulating collaboration and describes the Singapore Tissue Network as a matchmaker, which seeks to connect sample contributors to PIs who would be interested in using those samples. Now, the second quote here delves somewhat deeper into the mechanisms of this matchmaking and indicating that general descriptions of the samples, which some would describe as metadata, were available, which would allow PIs interested in using the samples to find those samples that they wanted to use. But then the detailed clinical data was not kept nor made available within the Singapore Tissue Network. And this was a deliberate decision. Government officials knew, of course, that researchers needed the data to do research, but told the researchers to go and get the data from the sample contributors, hoping that this would in the end result in collaboration between the two. This was, however, something that many researchers saw differently, and they figured that samples for which they could not get the clinical data directly were not very useful to them. This is sometimes described as a problem of reluctance to share materials and data, which is an issue that I will return to shortly, but it was not the only one. This quote shows that there was also a problem with the different timelines and sort of the questions about pragmatically data being available or being generated in the first place. The quote describes how researchers who, for example, would only get funding for a 5-year project would collect samples with the aim of also studying them longitudinally, but they would only collect a small part of the desired longitudinal data. If this happens only at the very beginning, shortly after the samples have been collected, this means that the samples basically become as good as meaningless for other researchers if no additional data is collected. So this is one of many reasons why researchers want to know where samples and data are coming from, or also in reverse, when they have the samples or data, who want to use them. In interviews, researchers declare that it is important for them to know who know who will use the samples, whether the other party can be trusted to have done solid sample maintenance and data collections, or whether they would use the samples, the materials responsibly. Researchers would also emphasize that these are not merely abstract scientific considerations. The STN might perhaps have addressed these, but researchers emphasize that it's also a matter of personal rapport. And I think this is nicely summarized by this one researcher who says in this quote that you need heroes and faces as much as hard science. So taking this a step further, researchers also emphasized that if they made materials available, they wanted recognitions. And this was not really foreseen in the STN structure, where they were supposed to give up the materials and share them without much thought about sort of questions of ownership and recognition. So within the setup of the Singapore Tissue Network, sample contributors on the one hand were afraid of losing control, of not getting recognition for the work, while potential users were afraid not to get the necessary data for research on the samples they wanted to do. And in sum, this turned the Singapore Tissue Network into something of a dead-end street. This situation became more pressing over the years as the collection of the Singapore Tissue Network grew, because it became more expensive to maintain, but it did not draw much interest at the same time. Many reflections on the fate of the Singapore Tissue Network emphasize this lack of use and rising costs, but these problems reflect deeper divergences around what different actors prioritized and the timeline they had in mind. Researchers were aware and generally accepted that research investments in Singapore served an economic purpose, but thought that government set the wrong priorities in its funding strategy, and that it expected generation of financial returns too soon. So ultimately, the government decided not to fund the Singapore Tissue Network any longer under somewhat unclear circumstances. They promised to return the samples to their contributors and made the equipment of the biobank available as well. Yet the table here on this slide shows how one person who was responsible for data management in a research institute had samples from various studies ending up in different locations all around Singapore. While this person tried to get all the samples back in one place, several researchers expressed concern about the future of biobanking in Singapore at the time, expecting no substantial support for these activities for the time being. Although this seems to have somewhat improved recently, as I've just recently heard about a biobank being set up for studies among the elderly. So it would be interesting to see how that develops. So after having done this research in Singapore and doing research in the current project on BBMRI Erik, I was struck by some similar issues and observations that looked a lot like what was happening in Singapore. Now, I want to emphasize that this does not mean that BBMRI Erik has this exact same flaws that the Singapore Tissue Network had, nor do I think that it is likely that the BBMRI Erik will soon be terminated as well. In fact, thinking from my sociotechnical starting point, it would make sense that different situations create different kind of dynamics and thus lead to different results. Still, there are challenges in European collaboration as well, and I think it's worth thinking about the similarities and differences around some of these. So let me begin by describing some of the motivations and promises behind the establishment of BBMRI Erik. There are various similar versions of sort of texts explaining why this is important. These particular quotes come from a policy brief written by the European or published by the European Science Foundation and written by a group of authors, some of whom were actively involved in initiating BBMRI, Erik. It derives from the idea that the study of the intricate factors that contribute to health and disease require large populations to study. And the idea is that these large populations are available in Europe because there are already many collections of samples and data, but these collections are technically, legally, and ethically fragmented. So this is an issue that needs to be addressed by harmonizing and coordinating how biobanks in Europe are run. And sort of following on the quotes on this slide, the policy brief concludes with a call to sort of build the network that would eventually become BBMRI, Erik, even though that was already ongoing at the time. This policy brief was published in 2008, and actually ideas for BBMRI date back various additional years. Now, the very idea of scientists writing a policy brief already suggests that there are sort of intricate connections between science and policy in this context. And in this particular timeline shows how BBMRI, Erik, was actually never a fully scientist-driven initiative. It always was strongly connected to sort of research policy in the context of the European Union. It first got a boost from inclusion in the first so-called infrastructure roadmap published by an intergovernmental advisory body, the European Strategy Forum on Research Infrastructures, or ESFRI, which listed several research infrastructures that it thought should be prioritized in development in 2006. And BBMRI stabilized when it became the second Erik. And Erik is a particular legal status. It means a European Research Infrastructure Consortium. This legal framework was introduced in 2009, and Erik was the second infrastructure receiving this status in 2013. Additionally, there's also an important role for EU-funded projects. The so-called preparatory phase of BBMRI, when sort of the ID and the setup of BBMRI was developed, was funded by EU research project funding, and the so-called implementation, or the so-called ADOPT project, which serves as an implementation project to both see if it would be possible to set up an international cohort of colon cancer cases from existing samples and data in biobanks, as well as the development of some of the BBMRI, Erik was supposed to deliver, was also funded with EU research funding. And as a sort of almost classic example of a European integration project, or due to its strong links, at least to the European Union, there is sort of a continued tension within BBMRI, Erik, between centralization of European collaboration and a sort of more distributed approach based on the different European member states that sort of runs throughout how BBMRI, Erik, works, which is again something I'll return to in a moment. So BBMRI, Erik, was always imagined to be a distributed infrastructures. On the one hand, this was in terms of the so-called hub and spoke structure, which means that it sort of has one central administration to which different member states are connected, and it's important to note that it's not sort of self-evident that these are member states and not, for example, individual biobanks. But it also refers to the idea that the collections would stay local, that the individual biobanks would retain some of their autonomy, and that BBMRI, Erik, would ultimately consist of existing collections of both population and disease-based samples. So the distributed character is paramount to BBMRI, Erik, both in terms of its organization and governance, as well as its operations. So the hub and spoke picture, the hub and spoke structure I try to represent in this picture at the top It means that there's a central administration, which is located in Graz here in Austria, which does much of the coordination and service delivery work. Then there are national nodes, which are sort of hybrid elements, since they include both national government representatives who ultimately pay the membership fees, as well as national network coordinators, so coordinators of the national biobanking networks. And members of these nodes then are individual biobanks. So this means that a biobank can only be a member of BBMI Erik via a national node. So if its country is a member, and sometimes the national nodes are involved in projects or development work with the central administration. In other cases, it's individual biobanks who do so. One example is that the German node has had a development of much of the IT infrastructure of BBMI Erik, including the development of an access procedure that is schematically represented here, a picture taken from the BBMI Erik website. And to this access procedure, there are two central platforms. One of them is called the directory, which allows the searching for aggregate descriptions of the available data and samples within specific collections. And the other one is the so-called negotiator, which allow anyone who is interested in getting access to the samples, well, anyone working as a researcher, to get access to these materials by directly negotiating with the biobanks who have the materials. So I can't go into too much detail here of how this works, but a few observations I think are interesting. So the directory again provides so-called metadata, which is supposed to be provided and updated by the biobanks themselves and sort of uploaded into the BBMI Erik directory. However, there's currently ongoing work on something called the sample locator, which actually allows anyone interested to directly sort of search within the inventory of the biobank itself. The negotiator platform, again, is provided by BBMI Erik, but BBMI Erik is otherwise not an active partner in the negotiations between people who have samples and data and people who want to use them. So both of these platforms actually show how the organizationally distributed character of BBMI Erik also is reflected in its operations and the particular kind of things it offers. So in this particular context, the idea of being pan-European confronts some challenges. On the one hand, membership does not include all of Europe, as the sort of map at the top, which shows the membership of BBMI Erik shows. But more importantly, perhaps trying to coordinate biobanks in different European countries can also be challenging. There are differences in experience and expertise that are sometimes considered fruitful in terms of being able to learn from each other. But various people also refers to some of the limits imposed by these differences. And there's a lot of reference to differences, particularly between the North and South of Europe, which is represented in this quote here, as a hindrance to collaboration. The sort of frameworks that the European Union provide are also not always helpful. For example, the Erik legal framework gives it a sort of particular and solid legal status, which should in theory make it easier for a research infrastructure to operate. But the legal framework was developed for all infrastructures, regardless of the particular field or discipline they work in. And thus, people involved in BBMI Erik sometimes consider some of the most pressing legal challenges that they have are not being addressed. For example, how to share samples across borders. Finally, the particular setup of member states governments who pay the fees also leads to some frustrations, as many researchers feel that member state governments do not pay enough for BBMI Erik to properly operate. And this is actually also something that BBMI Erik itself has communicated publicly in, for example, work programs and annual reports. Now, this points to some further challenges within BBMI Erik. Not only does the funding lead to some irritation amongst researchers, this particular quote from a former BBMI Erik employee refers to two conflicting strands within BBMI Erik, which are even reflected at the national level. And these are really related to the question how BBMI, Erik, is supposed to support biobanking, whether it's supposed to support research or supposed to do research itself. This is a question that is quite controversial to the extent that even one of the work programs of BBMRI seeks to clarify that while research is central to BBMRI, Erik, its ultimate core business is to provide services for biobanks. And some see this differently, wondering, for example, how the work done by the Central Administrative Office, described in the second quote, how the work of the Central Office actually relates to the interest and whether it even serves the interests of the individual biobanks that are distributed around Europe. So in light of the debate about research and services and what the sort of core function of BBMI, Erik, is, as well as around its distributed nature, one may wonder if this infrastructure actually serves research in the way it's supposed to be. But maybe this is the wrong question, since there are many different interpretations of what the purpose of BBMI, Erik, is. So some are concerned about, or some concerns about where the infrastructure is headed may illustrate this point. Some people say the main point of BBMI, Erik, is to improve access to data and samples for Europe. And as this first quote illustrates, we have barely made any improvements in this area. Others may say the key role of BBMI, Erik, is to support research as sort of a preferred service delivery organization for research consortia. But what we have become instead is a research organization that does research itself. We go after grants, we publish, etc. But that's not the point. That's not sustainable. So this exact same verdict, this exact same verdict of something not being sustainable was expressed twice in the quotes I included today. And this should not be surprising, as the sustainability of biobanking operations is a key concern in the field. Sustainability often includes issues of long-term funding, retaining donors as participants in longitudinal data collection, and lasting social and political support for research. And I would actually read these different formulations of sustainability as expressions of the same questions. Why are we doing this, and is it worth it? I think this question cannot be answered by biobank operators alone. You need the funding, you need the participants, etc. So we saw some considerations of the broader questions as they are answered by what we may call external social actors in the cases I described today. They show how biobanking projects can serve different purposes and develop different practices to that end. For example, centralized, standardized storage was important for Singapore's economic ambitions, whereas Europe's ambitions to enhance cross-border collaboration are pursued through a decentralized storage. It is important to note that economic benefits and collaboration are important in both cases, but priorities are set differently and are translated into different operational procedures. So the difficulties both the Singapore Tissue Network and BBMI, Erik, seemingly encounter or have encountered in stimulating the sharing of samples are similar, but they manifest in quite different ways and are addressed to different kinds of solutions. These difficulties, I would conclude, point to the broader issues at stake in making biobanking sustainable. These extend beyond funding or doing the work of getting donors to accept the importance of biobanks. It involves what I would call ongoing maintenance work, like it would for any infrastructure. So a road becomes unusable after a while if it's not maintained. Online communication tools need regular updates to fix bugs. But roads also need to be adapted to changes in traffic, to social priorities such as safety or reducing emissions, for example. So likewise, the maintenance of biobanking infrastructures is not only about their technical configurations, but also about the continued consideration of why biobanks exist and how they can be made valuable in, together with, and for society. So for infrastructures that need both funding, usually from public sources, and participation to remain in operation, it is important to not only tell why biobanks are important, but to also listen to why and how other actors involved, which can be donors, which can be researchers, which can be policymakers, as well as a general public, would like to get from A to B. Thank you for your attention, and I look forward to questions and comments.
Thank you very much, Erik. That was really interesting. Look, I'm just going to really invite people to add any questions that you might have to the chat, and I'll call on you and ask you. You'd be welcome to jump off mute and ask your questions. Look, Erik, I probably have just one to start with. I think that you know, thinking about BBMRI, Erik, and just the whole ambition of what was developed, you know, something that's pan-European and it's designed to encourage collaboration across borders. Whereas even probably unifying biobank at the country level is a considerable challenge in the absence of perhaps any kind of framework, you know, previously. You know, it was a very ambitious thing to try. I was wondering, are you aware of any data that would suggest whether BBMRI, Erik, has primarily facilitated sort of collaborations within countries, or is there evidence that it has built inter-country collaborations? You sort of alluded, I think, that maybe there hadn't been as much kind of cross-border collaboration, but has it been effective in terms of encouraging better use of biospecimens within countries?
So I don't have the specific, like I don't have very detailed evidence of that. Some things I did encounter is so one I think it has done quite effectively, even across borders, create some sort of coherence between biobanks in different places to at least sort of discuss some of the issues that they're facing. So it may not have resulted in, like this one person sort of critically observes, in more sharing as such at the moment, but maybe we should add a yet to that. Maybe it is sort of building towards that still. There's another quite interesting paper that a colleague in Spain wrote that comes to mind in response to this question, who is actually writing about, so Spain is not a member of BBMRI, Erik, but this person has done some research on biobanks in Spain and observed that they actually still kind of follow some of the forms of standardization and harmonization that BBMRI, Erik, seeks to develop. On the one hand, to make it easier, on the one hand, to sort of be able to join BBMRI, Erik, hopefully at some point in the future. But on the other hand, also of making it easier for them to collaborate with biobanks within BBMRI, Erik, even if they themselves are not part of it. So I think there are definitely developments going in that direction, despite some of the remaining difficulties of collaboration. Yeah.
I can see there's a question in the chat from Sri. I'm wondering about, I think, cryptocurrency. I'm just wondering, Sri, do you want to ask that question? I'm not sure. Yeah, look, I might certainly, if you want to ask that question, please just jump off mute. Toby, I can see, yep, you've got your hand up. Please.
Yeah, thanks, Erik. That was a very interesting perspective on the world of biobanking. Something that I myself only really kind of dove into about 3 years ago. In terms of some of the conclusions that you were drawing, and particularly looking at the kind of measures of success that BBMRI, the different perspectives that people had on what constituted success, whether it was increase or enhance access to samples and data, or whether it was, you know, kind of adding to European research infrastructure and what you deemed as success. Is there a sense that that biobanking as a pursuit is more supply driven than demand driven, and that when we are going out of our, you know, in our best interest to try and make samples available and to try and supply these needs, it seems like perhaps when we're creating biobanks, we're in some senses perhaps putting the cart before the horse. We know what we want to do, but do we have a sense of what other researchers, do we know what their demands are in terms of data and samples? And does that perhaps, from your perspective, make a difference to the kinds of the kind of collaboration that people might kind of entertain if they knew more about what others were interested in terms of building their biobank?
Thanks for the question. I think, because it sounds like it's a simple question, but it sort of touches on many different things. So I think some people within BBMI, Erik, would be happy to hear you say this, because they are making the argument that I think more sort of a demand orientation would be helpful and would be good for biobanks. And I think they are trying to sort of work towards that. So BBMI, Erik, is active in many different areas. One of the areas they are active in is sort of what they call stakeholder engagement, which they have done quite well and successfully with patient groups, which I guess is more on the supply side. I think they are working towards sort of having stakeholder collaborations more with industry on the one hand, and then sort of with the medical research community, large medical research organizations on the other hand, to exactly touch upon this question. I think one of the remaining problems related to sustainability, which I think is hard to solve, is that, of course, I mean, I guess the sort of optimal biobank has been collecting samples and data over a long period of time already and has them available for use, right? Because it's sort of at an ever more detailed level of knowledge that they're working, and right. So in some ways, a counter argument to more of a demand side is a conversation I had with a biobank manager in Singapore that comes to mind, who says, so what they were mainly collecting tumor tissue, and he said, we cannot really respond to the demand of researchers, because if we respond to the demand of researchers, and it's a researcher doing research on a very rare form of cancer, if we start collecting when the question comes, it will take us another 20 years to get the samples before you can actually start doing research. And I think this is sort of maybe a kind of catch-22 or sort of unsolvable issue with biobanking. That, you know, I think his perspective is legitimate and makes a lot of sense. So I think in some ways you have to also be kind of supply driven as a biobank, and I think the challenge is to sort of find a balance between that, and to then solve the question, of course, how are you going to maintain this collection of rare tumors that maybe somebody might be interested in 20 years, maybe nobody's ever interested in, and it costs money to keep all of them, right? So I think that's a very sort of real problem. But perhaps to that, the question is not so much supply and demand, but it's more of, okay, you know, sort of make clear why this is important to do it in this particular way. You know, why there are sort of these costs to biobanking that, you know, that actually, if you follow a supply and demand logic, may not make an awful lot of sense, because you're sort of keeping things for which there's no demand, but you need to sort of see that in a kind of different framework. So I think you need to sort of imagine different ways of saying why this is useful to do, in order to be able to maybe maintain a collection that doesn't immediately have a demand for it. I think that was one of the problems that they were having in Singapore. That there sort of was very much this supply demand kind of, I mean, a very kind of economized, if that's a word, logic behind it, which sort of didn't really work out in the end, because there were sort of such different expectations tied into that.
No, that's a really great answer, and yeah, thanks. I mean, it is something that's very much at the heart of a lot of discussions, as you rightly point out, that it's the economic imperatives are always kind of at the forefront of a lot of discussions about the infrastructure being maintained. Yeah, thanks, Erik.
Yeah. Thank you.
Erik, I guess just to follow up on something that you mentioned about the Singapore network, which I've always found very interesting, that issue of trust and how the Singapore tissue bank sort of may have not captured the trust of either of the main sort of set of stakeholders, either the people that were putting the samples in or the researchers that were getting them out. So I was wondering do you think that BBMRI, Erik, has taken specific steps to sort of improve trust? I guess I'm sort of asking this because there is some recent research that indicates that researchers do tend to go to their local biobank. They want to work with someone that they know, they want a face that they know, and that often inspires trust over and above a biobank stated adherence to sets of standards and things like that.
Yeah, that's a great question. I should ask them maybe if they draw particular lessons from a case like Singapore. I don't know. But I do think that there's quite some work being done. I mean, BBMI, Erik, quite actively works on sort of personal contacts, I think, in a way, for example, through kind of the conferences that they're organizing, kind of having different kinds of exchanges, always trying to, even though these are biobanking conferences, not sort of having only biobanking professionals there, but also medical researchers who may work with the materials in the biobanks. They have, for example, also been quite open about sort of kind of the more broader social and ethical dimensions of it. Also, I mean, it's also made my life relatively easy to sort of be in conversation with BBMRI, Erik. So I think they are aware of that issue very much, and they're working actively on establishing these kinds of relations that are important for building trust and familiarity between the different actors involved. Yeah.
Does anyone else who's on the call have a question for Erik? I think we've got a little bit of time. Yeah, I mean, I think a lot about biobank failure, to be honest. It's something that really worries me a lot, and I think that we don't. I think in science generally, we don't talk a lot about failure, and we need to, because there's a lot of failure in science, and if we don't talk about it, we don't learn about it. So I think that's what I really liked about your paper and some other discussions around biobank failure, even though it seems like a bit of a morbid topic. I think it's very important.
I agree. And so the interesting thing is, I've been trying to avoid using the word failure in relation to the Singapore tissue network, which may seem strange, but if you would talk to the government officials there, they would say this has not been a failure. This has been an experiment, and we sort of got an outcome, right? So you try something, it didn't work, and we move on. So from their perspective, it's not a failure. It's just something that they want to see if it works, and it didn't. But I think I'm not sure if I entirely agree if such an investment, is discontinued at some point. But I think an important aspect of this really is to not only think about failure in a sort of narrow context within the biobank itself, but to really see it in relation to sort of this environment within which it operates. And so I think, it's a bit speculative, but I think some of the problems in Singapore might have been avoided if there would have been sort of more kind of more direct communication and consideration of what the interests of different actors are, and what the expectations are, and how to maybe navigate those. Right. So I think it's important to always keep this broader context in mind, if we're thinking about why things work or don't work the way we would hope them to.
Yeah, I think in some of the things that you said about the Senior Partition Network, I could see things here at the Statewide Biobank that we are actively, like, we're not doing. I think to some degree biobanking is learning from these examples. For example, the risk of just storing large numbers of specimens in the hope that people will come and use them. That's not what we're doing here. So, and I think reassuring people that they are in control, that's an important feature of scientists. Most scientists value autonomy and independence, and they're that kind of people. And I think we also have to understand and work with the kind of people that are going to be using those samples and recognize what's really important to them. But it does, it's an active process, I think.
Yeah. No, I think that's right. I think it's a learning process. Many, and I mean, and to a large degree, that's also what BBMI Erik is trying to do, as in the process, sort of try and learn how maybe to do things better, what works, what doesn't work. And I think that's maybe even more so than sort of having a great design of how something should work. It's sort of having the flexibility to learn and to adapt. Yeah.
And I think possibly having the country nodes can allow those countries to actually adapt things for their local environment and what their biobanks are able to deliver and what their researchers are looking for. So I think that's a really nice approach, having that sort of distributed network, as long as the nodes can communicate it and feed their individual, what they learn. I think it's actually quite a powerful model for learning quite rapidly. I suppose that's something in Australia, because we're a long way from that kind of environment. I often look at BBMR and think, oh, gee, I'd love to be part of that. Maybe it's a little bit like the Eurovision Song Contest, where Australia has been invited to participate, whereas we're not at all a European country. Maybe, I don't know, an exception could be made at BBMRI, Erik.
I think it's actually possible. So I'm not a lawyer, so I don't know all the details of the Erik format, but I think it doesn't require all of the members to be European. It just does require, I think, at least half of the voting members to be European. So I do think there are some other Eriks where actually non-European countries are members. Of course, the issue is, I mean, so I agree that it's a nice thing to have these national networks that can also learn from level. It becomes a bit more complicated where the government, so that it's usually the science or health ministries get involved, who need to foot the bill at the end of the day, and that is that can be challenging.
Yes, I can imagine. Well, Erik, thank you very much. It was a really interesting talk. I think it's fantastic I always really appreciate hearing about biobanking from people who are, outside the sector. And I think, that external perspective can teach us a lot. And I think your talk's been a great example of that today. So thank you very much again for getting up early and speaking with us. And thank you to the many people who dialed in late here. And it was great to have you with us. Thank you again.
Yeah, thank you for having me. And it was a pleasure.
Thank you.